75% of people who ever have mental illness start in the age between 12 and 25. There was never anything designed for this age group.
Our system for supporting young people is divided into all of these separate streams of services, and young people often don't know where to go. With an integrated model of service, we're creating sort of a one-stop shop model of care so that young people can walk up to one door, they can step through that door and say, you know, I'm having a really hard time.
I wasn't in a good space. I have been struggling with a lot of mental health issues since a very young age. I've gone through different types of therapy for a lot of years. So by the time that I got to ACCESS, I felt like, here we go again, same thing, new person.
We have this divide between the children's mental health system and the adult mental health system. Young people fall through the cracks, and it's such a pivotal time in their development, in their lives. The mission is to create an opportunity space for young people and their families to be able to access all of the mental health and addiction services they need, as well as things like housing, education, income support. We also have outpatient services from the hospital. We have a visiting psychiatrist that does a clinic. All of those things in one location.
Running all over and meeting all these different people, it can get really overwhelming. So for sure, having everything in one space, working with the same people, it's definitely a huge help.
We're not just talking about locating together, we're talking about working together across organizational boundaries. That means they're getting the power of all those resources coming together.
It's just like a fun spot, like for people to come and hang out. Like less clinical way to approach mental health, and like it's a lot less intimidating for people.
Families come very burdened and exhausted. They're feeling a lot of loss and grief over their loved one who's not doing well. Sometimes they're just running on empty. First, we just offer peer support and a listening ear and validation for the difficulty of the journey, and then we navigate families to anything they're looking for in the community.
We engaged young people, and they told us that they wanted to have an experience that was warm and welcoming and didn't feel like going to the doctors. They also told us that they wanted to reflect the community, and so in this case we have a streetscape environment that reflects the sort of the dualities of Chatham-Kent that's both urban and rural.
If you're struggling with something, sometimes that's all you can see, but when you're in that environment where like you're given something else to do, like you kind of forget about it for a bit, and that's kind of helpful.
When you go to a standard therapy, it feels like you're going there to get fixed. Whereas here, I met people, I'm learning new skills. Hearing what other people have been going through, it just makes you feel like you're a part of something instead of just like going to an appointment every week.
I am on the Youth Advisory Council at ACCESS. We meet once a month and we just go over questions or concerns that the board has.
But youth engagement is so important in this process that they have a sense of ownership and a sense of pride.
They want to hear what the youth have to say. They understand that's how you're going to help them. It's like if you listen to them.
There is a better way. We can improve the quality of mental health and addiction services for young people if we listen to what they tell us they need.
The integrated model is the best model because no matter where you are in your journey, you can come to one place.
If they come to a place like this, they're much more likely to engage, to come back and stay engaged.
You can keep coming back to that place down the road even if you have different needs. And you know that when you come, there'll be a team of people who can help you.
If we can engage them early on in a positive relationship, it changes the whole trajectory.
We're like evolving the way we treat and look at mental health.
We know that we've had a significant impact on improving the lives of people, and we want to assist our colleagues across Ontario and nationally to join the movement of integrated youth services.
I think Having this space here is a beacon of hope for families.